Go.
Hi there, my name is Bilal. It's very nice to meet you.
Hi there, Bilal. My name is Harun. I'm one of the interviewers here. How are you doing today, Bilal?
To be honest with you, I'm a bit nervous, but I'm excited to go ahead and answer your questions, and I'm very happy to be here.
Absolutely. It's completely normal to be nervous, so hopefully it will go well today. So let's get started. Just, I want to know a bit more about yourself. So, why did you pick dentistry as a career as opposed to all the other careers that you could have chosen?
Yeah, I think that's a really important question, so thank you for asking it. So, for me personally, I looked into a few professions, and in all honesty, I was actually in a bit of a debate between dentistry and medicine pretty much all through year 12. Um, but after giving, both careers a bit more thought and obtaining work experience in both, I realized that there's some aspects of dentistry that stand out, more so for me than any other career. So I'll go into those. But yeah, it definitely wasn't a decision made overnight. It's something that I've given a lot of consideration to, and it probably boils down to a few reasons. So, firstly, I feel like it's a career that I can see myself progressing well in, and I know that within dentistry, basic professionalism, promotes a lifestyle where you have to continue to develop yourself, and that really appeals to me. I think it's also this ability you have to really make a difference on people's lives, not just physically, but mentally as well. So you really have the psychological ability to help patients feel better. And finally, I think dentistry as a concept is really rewarding. And I've seen that on my work experience with some really, eye-opening patient cases. So I'll go into each of those in a bit more detail if that's okay. So with regards to this idea that dentistry is a career you'll continue to develop in. I actually learned this when I went to a conference for students actually about dentistry and the sort of opportunities there are to develop yourself into research. And from that, I learned that dentistry is a field that is really ever evolving, and that's something that really appeals to me. And I know that dentists themselves, when they qualify, they have to meet their continuing professional development sort of hours. And I think it's like 100 hours every 5 years. And within that, after speaking to dentists, I realized that that's improving, the way you communicate with patients, your clinical competencies, and your ability to perform different treatments. So that idea of constant growth really appeals to me. I feel like in my own life right now, that's something I've been trying to nurture, this ability to expand my abilities and expand my skill set, and something I definitely want to continue moving forward. Um, in terms of this ability to make an impact on people, I've realized that it's both mentally and physically as well. So, on my work experience, one type of case that really stood out to me was managing patients with dental anxiety. Often, as a dentist, you had to really let these skills of excellent communication and empathy sort of drive the way you interact with those
What
kinds of
does
patients.
communication mean to you?
Very good question. So I think communication is one of the most important skills for a dentist. Um, I think I would probably split it up into two components. So I've noticed that there's like a verbal component to communication and a non-verbal component as well. The verbal is sort of the words you say and how that makes patients and generally people feel, but non-verbal is so important as well. And this is like your para language. So the tone in which you use, how quickly you speak, your eye contact shows a lot of engagement with whoever you're speaking to, your body language. This all goes a long way to show patients, especially in a dental practice, um, a lot about the way you feel when you're treating them or the standard of care you're providing. This just very simply the way you communicate says a lot about you and the emotions you have as well when you're interacting with a patient. So, for example, when you're managing someone with dental anxiety, you'd be empathetic, so you try and understand where their anxiety is coming from. I think a really good thing to know about dental anxiety and empathy as a skill is that when we express this as a skill, it's an ability to understand how a person feels and then adapt the way we treat them based on their emotions. So some patients may be anxious about a needle, some may be anxious about, just the concept of something going into their mouth. So it's very important to be empathetic in the sense that we should understand each patient's concerns individually, then treat them according to that. I think communication then also plays a really important part with empathy. Once you understand what concerns you're dealing with, and you've explored a patient's ideas and concerns and expectations, you can then move forward and really tailor the way you communicate to match those needs. So if you've got
Absolutely.
anxiety, yes,
Absolutely. So you've mentioned the term anxiety.
yeah,
Tell me a bit more about that. What's caused anxiety in your opinion? What leads to dental anxiety?
I think it's a range of different things, and it's hard to just say that there's one thing that causes anxiety because it's so dependent on every patient. Like I remember on my work experience, there was a middle-aged man who'd come into dental practice after 20 years, complaining of severe pain, and he actually told the dentist that he hadn't been to see anyone in the past 20 years after an incident that happened 20 years ago, where I think he had a tooth extraction and his tooth just wouldn't stop bleeding, and his fear arose from blood. But then I've seen patients who have a fear of the drill, or like I said earlier, patients who have a fear of something just going into their mouth. And I think once more that just reflects the need as dentists to be people who are sensitive to each person's situation individually, and to make sure that we explore every patient's concerns individually and then treat them according to what their concerns are. And I think doing that, providing that individualized and really centered care is something that's also a part of professionalism for dentists. I know like the first standard for the dental team is to put your patient's best interest first. And that's really been reflected to me through the way that we really individualize the care we provide.
So you've mentioned kind of reflecting on treating patients as a communication, empathy. What skills do you think a dentist needs?
Yeah, so I think as a patient, there's expectations you have coming into a practice about what a dentist um, sort of should have within their skill set to treat you well. I think as a patient, I'm trying to think about this. What do I want from my dentist? I'd say I want to feel safe when I'm being treated by my dentist. I'd say I want to feel as though I'm being treated by someone who's genuinely going to do what's in my best interest. And finally, I want someone who is understanding of my concerns. I'm going to a healthcare professional, and at the end of the day, I want my concerns to be dealt with professionally, and I want whatever I raise to the dentist to be kept between myself and themselves. So I think based on that, there's a level of honesty and like integrity I expect a dentist to have to be able to maintain my personal information and keep that confidential. I think in terms of the way that I want to be cared about, I want the dentist to communicate with me cooperatively and in a caring way as well, especially if I'm discussing sensitive things. Emphasis on that word cooperative. I think with patients, when they come to a dental practice, it's very easy to almost have this power relationship in the sense that a dentist provides you the treatment, the dentist has all the knowledge, etc., etc. And you're in this position where you may feel a bit less than the dentist because you're going to be told what you can or cannot have done, and you can only say yes or no to that. You know, that already just sets a bit of a divide. So I think as a dentist and as a patient, you'd want a dentist to sort of integrate you into the whole treatment planning process, and really sort of be a good team worker in that sense, in the sense that they communicate in a way that makes you feel involved with everything that's happening with your care.
Absolutely.
Um,
Let's go on from that to a bit of a different topic.
sure,
So let's go on to something a bit more ethical. So
sure.
you imagine the situation: you are a dentist, and you
Okay,
are working during the pandemic, the COVID-19 pandemic, and one of your patients, John, he requires a root canal, but he's refusing to come into the clinic because of a fear of being infected by COVID-19. How would you deal with John?
okay. So just to summarize, then we have a patient, I think, who's come into a dental clinic and they don't want to receive any treatment because they're afraid of the COVID-19 pandemic.
Well, they
They
haven't come into the clinic yet. They're
oh,
fearful of coming into the clinic. They're usually your patient that you've been seeing for the past few years,
right.
but they're scared of coming into the clinic because of a fear of COVID, but they require a root canal. So what do you think? What would you do?
Okay, thank you for correcting me. So I think the first thing I'd do here is just to explore the patient's concerns. I would actually want to find a way to get in contact with them and have a discussion with them as to explore their ideas, concerns, as to why they don't want to come into the practice. I think first understanding the patient's concerns is really important. And then I'd also want to deal with them. How would I deal with them? Again, I think it's about being really empathetic. And that again just comes back to understanding the patient's concerns and then doing what's in their best interest. So once I've found out what he is exactly concerned about, for example, it could be the fact that he's aware that there's aerosols produced from some of the treatments that dentists do, and he's fearful of um, contracting COVID or some other forms of diseases from that, especially with everything going on in the media right now. It's completely understandable as to why he may be worried. So although it's hard to communicate over the phone, I think I'd want to speak to him in a really gentle and reassuring tone, just to let him know that his concerns are completely valid, first of all. But there would be some points I'd like to add to that. Firstly, I would try and inform him um, of the sort of universal precautions we have in practice. So just the basic things like sterilizing all of the equipment. But then I'd also tell him some of the measures we put in place for COVID specifically. So for example, the PPE we're wearing with FFP3 masks, and the introduction of fallow time to make sure that after every treatment, there's time for the COVID particles um, to be taken away from the clinic and for efficient ventilation system to be put in place. Because all of these things are things that reduce the chance of cross-infection. At that point, I'd probably communicate that and still gauge his concerns and expectations and what's going on in his mind after hearing that, because that may have been done enough to alleviate his concerns, but he may still have some underlying anxiety. So again, I'd still want to explore that and sort of get him onto the same page. I think after doing that, I'd probably inform him of the risks of not actually having a root canal. I understand that you have a root canal when there's an infection in your pulp, for example, and that can be, it can lead to really detrimental things if it's not treated early on. So I think I'd explain the implications of what would happen if he wouldn't have that the root canal treatment done. But when
Perfect.
explaining that, I think I would remove dental jargon from my speech just so that it's at a level he would understand as well. And yeah, finally, at the end of that, I think I just want to give him consent over whether the consent to actually go ahead with coming into the clinic and having the treatment or not, provided he has capacity, because that's another guideline for dentists to follow, to
Sure.
always obtain valid consent.
Let's kind of go on to something a bit different because you tackled that quite well. So let's go on to a bit more about yourself. So just to let you know a bit about dentistry, it's obviously, I'm sure you know, it's a 5-year long degree, and it's known to be one of the hardest degrees there are. And especially in recent times, there's been a huge amount of things such as imposter syndrome, where people feel that they don't belong at the university. They're quite fearful. Uh, they just don't believe that they belong in the university anymore. They're scared. They're stressed. So, how do you personally deal with these kind of feelings, or if you've dealt with them, or how do you deal with stress generally?
Firstly, just to clarify, is this specifically about stresses in dental school or stresses as a dentist?
I want you to talk about dental school first, because let's get through 5 years, then we can talk about being a dentist.
Fair enough, yeah. So I would say that firstly, I'm aware that stress in dentistry, especially amongst dental students, is a very big thing. In fact, I was actually reading a paper about this by the BDJ, from the BDJ, and there was a really interesting statistic that I remember from it, that I think 54, or I think it was 54, 45% of dental students actually suffer from some form of psychological distress during dental school. So there's no question about the fact that dentistry is a very challenging career and it's very hard. And after speaking to dental students as well, that's something I've realized, that it's not an easy degree, and there's going to be times where you're pushed to your limits. And yeah, another thing is that in dental school, you're in an environment where you're amongst really high performing people, really high performing, really high achievers. And it's easy to compare yourself and bog yourself down when, you aren't perfect or you aren't top of the class at one thing. But I think, especially in dental school, one of the things to really work on is learn to take like a collaborative approach with your peers. So instead of being in a mindset and in a state where really harshly compare yourself to other people, it's better to kind of work together with your peers in a way where you can raise concerns to one another when you are feeling distressed, and you can kind of help each other academically and clinically as well when you start to go into the later years and you get into actually practicing and using that manual dexterity that is so important in dentistry. In terms of when I've personally dealt with stress, um, I feel like there's situations where I've been stressed before, and I've always found that reflection and self-evaluation, sort of finding a way to take steps to improve on myself, has been a good way to tackle stress. So one thing that I recall upon is when I was sort of tutoring elderly people at my local Inspire Centre. I think this was something I did to sort of help elderly get better at using technology. Um, and in the first few weeks of doing this, admittedly, my method toward teaching them was really bad. And I was really getting stressed that am I making sure, well, helping these elderly people at all because unfortunately they suffered with hearing difficulties. So it was really difficult for them to hear me at all times. So I sort of reflected on this. I went home and I thought, what more can I do to actually benefit these people? So I decided to make my sessions a lot more interactive. I used iPads which were on site, and I used like whiteboards to help sort of explain what I was doing as I was going along. Um, and then there were also tutors nearby. So when I was delegating these lessons, the people or the elderly who had, really bad hearing, I'd make sure they'd always have like a mentor alongside them just to help guide them through the sessions. So I think, yeah, when you're dealing with stress, often there's always a way out. You've just got to really look at that situation, reflect on it, and see what steps you can take to move out of it. With that being said, stress has effects on our, on our mental health as well. And sometimes just talking to people and raising concerns,
Yeah.
having a good support network is really important to
Yeah,
alleviate.
we've been trying to do that as a university recently, trying to get as many people to just talk about their kind of any issues that they're having, be very open about it. Kind of, there was a lot of stigma in the past about this whole issue of mental health, and we're trying to move away from that now, which is why I asked you the question to see what your kind of views are on it. So you seem to line up with our university policies here, which is quite good to hear. We've actually come to the end of the interview. Um, just got a few minutes left, half minute left, let's say. Do you have any questions for me before we end?
Yeah, I actually do have a few questions for you. So, what is your role in dental school more specifically? I
So
feel like,
I'm actually a student here myself. I'm
oh,
a first year, so uh, yeah, I'm a student here.
and how are you finding first year?
I'm really loving it, to be honest. Obviously, because of COVID-19, I haven't been able to go into clinic,
Yeah,
which has been a bit of a struggle. But apart from that, I mean, it's understandable, to be honest, because you've got to make sure that we keep our patients safe, uh,
100%.
and keep ourselves safe. So
Yeah,
I think the clinic time's been prioritized for higher years. But like other than that, like it's been amazing studying all the parts of the body and just the mouth, and it's been incredible. And you're gonna love it when you hopefully come here.
yeah.
Uh,
Thank you. I mean, I really do look forward to starting.
Perfect.
Yeah,
It was
thank
lovely to meet. It was lovely to meet you, Bilal, and I hope you have a really
you.
good day. Bye.
Take care.